Drug abuse is fast becoming an epidemic around the world. The ratio in Nigeria is quite alarming, as many people are into drug abuse on most especially prescribed drugs. What can be done to curb this trend? Our expert on the program this morning will answer this question and many more. Hello and welcome to Health Business. I'm your host, Oluwatoyin Kolaole. And before we bring on our expert, let's get to see the news. Stay tuned.
Following the federal government of Nigeria restrictions on use and importation of codeine to curtail widespread abuse of the drug, especially by youths across the country, community pharmacists in Lagos say the ban may not achieve the desired results if the various open drug markets in Nigeria is not closed down. National Chairman of Association of Community Pharmacists, Albert Alkali, made this known to health journalists in Lagos. Alkali noted that the chaotic drug distribution system has given room to charlatans.
The manufacturers have corporate responsibility to ensuring that their products are don't find their way to illegal premises and being misused. However, the major stakeholder here are the regulators. The regulators should be up and doing. There should be enough pharmacovigilance to be able to know that there is a product that is being abused in the system and investigations to find out where the abuse is coming from. However, the oversight by regulators need to be done, especially on the manufacturers, to ensure that they manufacture well and distribute to the right channel.
Alkali, however, advised the Pharmacy Council to track and trail control of medicines from manufacturers to the point of dispensing.
Joining me on the program this morning to discuss drug abuse and misuse among young people in Nigeria is a pharmacist, a former chairman of the Industrial Pharmacists in Lagos, and also the former chairman of Drug Distribution Guidelines of the Pharmaceutical Society of Nigeria, Dr. Obalolu Ojo. You're welcome on Health Business.
Thank you.
So let's start off this way. Educate our viewers on the difference between drug abuse and misuse.
Thank you so much. When we talk about drug abuse, it means a pattern of use of drug which is not in line with the prescribed standard. When you use drug in amount or through the route that is not in line with the standard prescribed, then that's an abuse of drug. They are twin sisters, so to say, when you talk about misuse. Misuse of drug may be referring to a situation whereby a Toyin got a prescription of paracetamol 2 times daily for something. Then a John, who has not seen a doctor for diagnosis, just approached Toyin that, look, I have this problem. Ah, yes, I had the same problem yesterday. And this is the drug I have, take. So that is a misuse of drug.
So why do you think drug abuse is on the rise in Nigeria?
Well, first and foremost, let us get it clear, drug abuse has been with us for some time. In actual fact, the first documented case or epidemiological survey that was conducted in this country was done as far back as 1943. So it is something that has been around. What we're going to be talking about now is a resurgence of an existing danger. The question we may ask, why? There are so many factors that could be responsible. But maybe the one that we can really come to think about now is the current economic condition in the country. People are stressed. And when people find themselves in that kind of stress situation, the natural thing is to look for avenue, to release the tension. Unfortunately, most of them fall victim of drug abuse.
Tell us about the recently released drug distribution guidelines by the federal government. Do you think this can help curb the trend of drug abuse in Nigeria?
Yeah, when we say recently, it's not so very recent. The last published guideline was in 2012. Even before that time, there have been some other attempts. And the one that was published in 2012, which we call the new drug distribution guideline, actually established a hierarchy, of the drug distribution channels, putting the manufacturers and the importers at the top of the ladder. Then you have some other levels of the chain, down to the retailer who will eventually hand over the drug to the people who needs it. What I can say here is that guideline actually seek to instill sanity into drug distribution. Once we have that Arakaka order, it is possible for us to be able to do an audit trail. Anytime we find that there's a dislocation in the system, we'll be able to know where did it go last and to do a recall if we need to do it. More importantly, it will make it, it will restrict access, to sensitive drugs, such that we may be able to contain the issue of drug abuse that we are currently witnessing.
Tranquilizers like codeine and tramadol and cough syrup with codeine are presently being abused in Nigeria. What is the role of manufacturers of this drug in making sure that these drugs are not abused?
Well, these drugs that you mentioned, they are being abused quite all right, but they're not the only one being abused. We abuse virtually everything in Nigeria now. People abuse coffee, people abuse tea, people abuse even mineral drinks, carbonated soft drinks. You see people taking so much of it and things like that. Now, will a manufacturer decidedly pump out drugs when it is known that it is being abused? I want to say on a general note that the answer will be no, especially for those manufacturers who are operating according to ethical standard. If, for instance, I work for a company that was really in charge of tranquilizers, the benzodiazepines. I was marketing manager for Roche, Nigeria Limited. I left Roche in 2000, and I know what we do in order to ensure that this drug do not get out of hand. We don't sell to you just because you give us an order. No, we must know who you are and what we have been doing before. And who you are in this particular case is who that person who is the head of the business or who is the operator of the business is. If he's a drug abuser himself, most of these drug abuse happen among the professionals themselves. And when I say the professional, I'm talking about the nurses, the doctor, the pharmacist, everybody. We could have some of the people that you may not know because it just come and appear normal, but it may be abusing drugs. And that is why we always check who are the people behind the business that we are selling our drugs to.
Now, let's move to the causes of drug abuse. What causes drug abuse? Why do people go into abuse of drugs?
Well, they are numerous in terms of causes. There are some theories that have been propounded as to why people abuse drugs. But one thing I want us to establish now, which will help us to curb it, is that drug abuse should not be regarded as a character flaw. So that when you see somebody abusing drug, and you think, this one was not properly brought up, this one was not well trained, and things like that. It is a medical condition that develops over time. How the demand get into it is what we are going to be talking about. But we should not look at them as people that with character flaw, because that will not make us to be able to extend a hand to them. So if we now look at some causes, let's start with peer influence from the youth themselves. I want to belong. It's happening. My friend is doing it. We're in a group. I mean, it has happened to us before. My first time of trying to smoke a stick of cigarette was we were just in a group and everybody is smoking, only me. Say, gentlemen, what is happening there? Okay, let me have one. I did. But I found out that it's not good for me and I stopped. Since that, I'm talking about when I was in the university. So it happened that people are actually influenced by such peer pressure here and there.
The Ministry of Health just banned cough syrup with codeine. Do you think this is enough to curb the trend of drug abuse among youths in Nigeria?
Certainly not. Certainly not. But first, let's thank government for doing something. The usual response of government, especially this government or Israel, does not come so swiftly. I think this one came after the BBC expose on undercover operation, and almost immediately government came up with banning codeine containing syrup. The way I see that on a short-term basis, it will reduce availability of this drug. Okay? But that is the best we can get out of it. What will happen really, in reality, is that the business in this drug that have been banned will now become a black market business. And guess what? Everybody will now be looking for a way to get it under the table. Our borders are so porous. It will come from Ghana, it will come from Cameroon, it will come from Benin Republic, it will come from all our neighbors. And people will have to pay more for it. And paying more for it means that they're looking for a source of getting the money. And, it's a chain reaction, so to say. It's like we are throwing away the dirty bath water and we throw the baby away with it. Yes, codeine is a good drug. It's a very powerful antitussive. It really suppresses the cough center, and that is why it is used in cough syrup. At the same time, is a member of the opioid family. So that tendency to elevate mood, to kill pain, to make you feel good and things like that is there. Rather than say we ban it, I thought what we should do is to take a very holistic view of the drug system, everything that pertains to drug in Nigeria, starting from procurement, manufacturing, importation, distribution, and retailing. And for us to look at that chain and see where the weaknesses are situated and do whatever it is possible for us to eliminate it.
Many studies have shown that young people are culprits of drug abuse in Nigeria. What is the role of associations like Pharmaceutical Society of Nigeria, Pharmacists Council, and other related agencies in making sure that the ratio of drug abuse is reduced drastically?
Yeah, thank you. Let's start with the pharmacist. And I must tell you that we're doing a lot. We have a president who has been so very active about this, and has been moving from one place to the other. And the number one thing is advocacy. And this, I tell you that we are doing it. I was in Kano recently, addressing a group of people that, look, this is the danger that is inherent in using this drug. You can use your time for some other things. You can do this, you can do that. And I tell you, I will be in Ilori in the next 2 or 3 weeks for the same thing, addressing program that have been organized by pharmaceutical groups here and there. So that advocacy, we are doing a lot. But you're talking to me today is part of the advocacy, just to let people know that, look, yes, things may be bad, but don't kill yourself, before the solution to the problems will come. Again, from the pharmacist's point of view, is to continue to remind our colleagues about their responsibility to the society. And the way we are trained is this: when there is a doubt, resolve it in the favor of the patient. So drugs that are prone to be abused, even if you come to me, I was running a pharmacy before, you come to me that you want a drug that is not prescribed for you, even if it is prescribed for you, I want to know the doctor that prescribed it for you. And for how long you have been using it. Why? Because I hold you responsibility. Even the money that you pay me, I'm duty bound to offer you that cancer. Because I know about the drug, you may not know about the drug. Then again, the agencies that are responsible, they need to be empowered. Please, don't go blaming NAFDAC. Don't go blaming Pharmacists Council of Nigeria. Don't go blaming NDLA. Ask yourself, do they have the tools? Do they have the resources that they need to be able to discharge their responsibility? If I don't know anything, I know about Pharmacists Council of Nigeria. The gentleman registrar may want to do so much, but what resources does he have to be able to discharge his duty? So government need to empower them. Finally, on government side, it is important that we get drug distribution system sanitized. A situation whereby anybody, anywhere can have access to drug will only make us to fall into the problem that we are finding ourselves now.
All right, so all hands must be on deck in curbing the trend of drug abuse in Nigeria. Thank you so very much for being part of Health Business this morning.
My pleasure.
Mother and Child segment is next on Health Business.
Measles is a contagious viral baby illness, a bit like the other contagious childhood illnesses. Babies usually contract it between 6 to 2 years. What are the symptoms of measles? Measles in babies often starts suddenly with a high temperature, which usually lasts for about 3 days. After about 3 days, the fever may break, and about the same time, a fine pink rash erupts over baby's torso and just encroaches onto the upper arms and thighs. Accompanied with runny nose, cough, red and swollen eyes, a more obvious early symptom is small gray-white spots inside your baby's mouth. The spots may look like grains of sand salt. All symptoms of the rash and irritability should clear within about 5 to 7 days of eruption of the rash. Treating baby measles. There is no real temperature for baby measles, but use these tips to keep the fever under control. 1. Undress baby and keep only his vest and nappy on. 2. Cool the room by opening all the windows and switching on a fan. 3. Wrap cool wet linen clothes around your baby's legs and arms, changing them every couple of minutes. Increase your baby's liquid intake. 4. Avoid giving small babies and children aspirin. Paracetamol-based medication is safer. 5. To help baby through the issue phase, add a pot of rooibos tea and a handful of bicarbonate of soda to his bath water and apply a calendula-based cream to soothe the itch. Keep up baby's fluid intake, but don't force him to eat if he doesn't want to.
Next on our lineup is Regenerative Medicine with Dr. David Ikudaisi.
Hello viewers, welcome to today's episode of Regenerative Medicine. For those of you that are watching for the first time, I am Dr. David Ikudaisi, and I would like to quickly explain to you what regenerative medicine is all about. This is a game-changing area of medicine with potential to fully heal damaged tissues and organs, offering solutions and hope for people who have conditions that today are beyond repairs. Regenerative medicine comprises platelet-rich plasma therapy, also stem cell therapy. There are 3 types of stem cell therapy: embryonic stem cell therapy, induced pluripotent stem cell therapy, and adult stem cell therapy, which is what we're going to be talking a lot about today. For those of you that have not heard of platelet-rich plasma before, or some people call it PRP, it is blood plasma that has been enriched with platelets, 5 to 6 times the baseline. PRP, or platelet-rich plasma, contains platelets which are cells that have no nucleus, and when these platelets are activated, the cytokines and the growth factors in them are released to help to accelerate the healing process in the body. This leads to regeneration of any degenerative part of the body. Example could be can be used for hair loss, joint pain, diabetic wounds, orthopedic conditions. Can also be used for cosmetic reasons. It's very good for male and female sexual dysfunction treatment. Platelet-rich plasma therapy also has applications in the orthopedics world. It is used for back pain, joint pains. It can be used for plantar fasciitis. That's what they call ACL and PCL. That is anterior cruciate ligament and posterior cruciate ligaments. If these are partially torn, platelet-rich plasma can help to repair them. Likewise, rotator cuff tears, that is problem with the shoulders, meniscus tears in the joints, and just back pain from injuries to the back, and can be facet arthropathy, different causes. In addition to platelet-rich plasma therapy, like I mentioned earlier, stem cell therapy too can also be used to regenerate the body. Actually, stem cell therapy works better and faster than platelet-rich plasma. But today, when I say stem cell therapy, please try and remember I'm talking about adult stem cell therapy, because that's the only one out of the 3 types I mentioned earlier that has been proven to be safe and has clinical application as of today. A stem cell is any cell that can replicate itself or differentiate into any matured cells. It can differentiate into cartilage, fat, bone, muscles, and heart muscles as well. Likewise, the skeletal muscles, pretty much any tissue or in the body. I know some of you that are viewing this program right now are already thinking, what are the specific conditions that this so-called regenerative medicine can address? To make it easier for you, if there's any disease that is being caused by tissue degeneration, just keep in mind that regenerative medicine, either in terms of platelet-rich plasma or adult stem cell therapy, can actually help to regenerate that tissue or organ. And instead, to make it a little bit even simpler, I'm going to list some examples for you. Platelet-rich plasma therapy and adult stem cell therapy have local applications. That is when you talk about things like carpal tunnel syndromes, erectile dysfunction in men. It could be avascular necrosis of the hip joints, facet arthropathy of the back, plantar fasciitis, degenerative disease, multiple joint pains, back pain, female sexual dysfunction, urinary incontinence in some female. It also has cosmetic application. To understand this even further, adult stem cell therapy has both local and systemic application. I like to refer to the applications of adult stem cell therapy as anti-aging because it is kind of a generalized treatment that can take care of multiple conditions in the body, either it is tiredness, fatigue, fibromyalgia, chronic kidney disease, lupus, rheumatoid arthritis, multiple sclerosis, congestive heart failure, diabetes, cerebral palsy, spinal cord injury, autoimmune disorders like Crohn's disease, multiple sclerosis, even infertility. There are some conditions like motor neuron disorder or ALS that we are seeing improvement with the use of adult stem cell therapy. In this short time, I hope I've been able to educate you on what regenerative medicine is all about today and the things that can be used to treat. I hope to see you at our next week's episode of Regenerative Medicine. Thank you. See you next week.
This is where we draw the curtains on health business this morning. We still need your support in terms of adverts and sponsorship to keep the program running. Please call the numbers showing on your screen to be part of this program. I'm your host, Oluwatoyin Kolawole. Remember, living healthy is a serious business. Bye for now.
Thank you.